Welcome to the Speechie Side Hustle podcast. Today we're talking about going from hospital leadership to private practice success, building a niche for adult SLP clinic. So today's learning outcomes will be to identify steps to transition from a traditional healthcare role into private practice, describe how to build a specialized medical-based niche, explain how community programs and physician relationships support patient care and practice growth, and discuss ways to build a sustainable adult private practice while maintaining clinical quality. So I'm so excited to introduce Kristin Winter. Thank you for coming on the podcast. Would you be able to introduce yourself to our audience?
Sure. Hi, my name is Kristin Winter. I am the owner and speech pathologist at SpeechRx. We are a speech, swallowing, and voice specialty center in Stuart, Florida. We're about 40 miles or so north of West Palm Beach on the East Coast, just to give you a geographical location there. And yes, we are just an adult-based practice. We do not see children. I have to say, we've seen a few teenagers for voice therapy through the years, but primarily 18 years and up.
Awesome. Thank you so much for coming. I'll do a brief overview of who I am for anyone who doesn't know, but I'm Nicole Humana dos Santos. I'm the COO and ASHA CEA for Tassel Learning and the co-host of the Speechie Side Hustle podcast. I've worked as an SLPA with a bachelor's degree from Emerson College, and I am the founder of Nicole Humana Creative, which supports small businesses with branding and design strategy. And I'm passionate about helping clinicians build aligned, sustainable careers through entrepreneurship and creative growth. So let's get into it. So you spent years in a major health system in a leadership role. So what made you decide to walk away from that and start your own clinic?
So I started my side hustle back in 2020. So if you can imagine what happened to everybody, it was the summer of 2020. I was the lead speech pathologist at my local hospital. And honestly, my husband's job had dried up at the time. And so I was actually seeing a few patients on the side. Someone in my neighborhood had a significant stroke. So I would work with him after I came home from my full-time position. And it really just sort of grew from there. I started seeing a few people in the homes. And again, 2020, moving into 2021, we were still in lockdown mode quite a bit. But I knew that there was a need out there and that more people were needing speech pathology services in my area. And so it grew from just seeing people in the homes to then starting up my own clinic.
That's awesome. I think a lot of people can relate to that experience too, no matter if you're seeing adults or pediatrics, starting with like a typical 9 to 5 and then slowly moving to having kind of that little bit of a side hustle. So, when you were working in the healthcare system, what were different things that you were seeing that maybe you felt like needed to change or that you could do differently?
So my area did not offer these swallowing studies, the flexible endoscopic swallowing studies. And I had taken the coursework actually, prior to March of 2020 and knew that that was something that really was needed, particularly, for the adult population in the hospital and then even out in the community. And so I initially, based my practice on offering fees at the office and, being able to provide patients their results and their plan of care right there in the session with me. Yeah. So that was really the first thing that I identified. I also saw that there was just a bit of a need. There was actually, even though it was COVID, I know that there was a wait list at our hospital's outpatient clinic. So I knew that the demand was there and that if I could start, a super strong fees program in my clinic, not needing like hospital regulations and hospital grade disinfectant that would just really take off and flourish for SpeechRx.
Oh, that's awesome. So it kind of started out a little slow building from there. So what did you feel like was the biggest risk in making that full transition?
Yeah, I mean, I'm sure just like anyone, that started a private practice is the risk of, am I going to be busy enough? Am I going to be able to support a full-time position? And because it was COVID, it was really crazy times when we all look back on that. But then I think because we were in that time of our lives, it gave me lots of times at night and on the weekends just to dive in and read literature, take lots and lots of CE courses and, really hone my skills and hone my business and marketing skills. So in that regard, there wasn't really much going on, at night and on the weekend. So it really gave me that time to really market SpeechRx and just take off from there. Yeah.
Awesome. Yeah, I think a lot of us can relate to different things we did during COVID and not having those distractions and how we can kind of use that to, I don't know, do something different. That it was a scary time in a lot of different ways, but it also gave a lot of flexibility and a lot of time that in our normal lives we don't really get. And even in 2026, that maybe we don't have that luxury as well, but it's still possible. So you didn't just start a private practice, you built a really clear niche around dysphagia and adult care. So, how did that really take shape?
So I really honed in on, like you said, dysphagia management and assessment, and also head and neck cancer patients in the head and neck cancer population. There was definitely a need for that as well. In my area, there was not, from what I could see, specialized head and neck cancer adult speech pathologist. So I started marketing to ENTs and to pulmonologists and really started, I would say, a great name for SpeechRx. We started getting lots of referrals for head and neck cancer, but then also, the strokes and the neurologically based patients and Parkinson's, they were being referred to us as well. So again, like knowing that I really wanted to niche into dysphagia and voice, I hired another speech pathologist who her specialty was working with aphasia and cognitive communication disorders. So then I worked with the dysphagia voice patients, and then she specialized in just taking on the patients and her specialty. And then, of course, in doing a lot of research about that, that's what I really think makes SpeechRx stand out is we have specialized speech pathologists that really hone in on their skills, and we're not generalists, which being a generalist, it's a great, skill too if you want to see everything. But I felt for my practice, I wanted us all to be more in a specialized role and really just to be able to provide the best care.
Right. So, from almost like a marketing standpoint, when you first started, what do you think were some of the first steps you took to help people understand that you were a specialty clinic and you weren't there to just take everyone in a general practice sort of way?
Yeah, so I built flyers and rack cards and just boots on the ground, just did lots of marketing to physicians that I knew and had worked with for about 13 years in the hospital. I also worked in their outpatient center early on. So I had some really good networks of physicians that I could market to that knew me. And again, just highlighting that we provide fees in the office. We can send the results out, same day, provide clear plans of care. I felt like that was probably the one big thing for us that really helped us to stand out. I think building those rack cards or even just smaller brochures that really highlight your specialties and telling physicians, what you can do to help their patients. Not just I'm a speech therapist, I'm a speech language pathologist, but this is what we specialize in, and we are here and ready to help your patients live a better life.
Mm. So, how do you feel like you had that information from sort of this network of providers about there being a need in the community? Was it just your previous experience in healthcare? How were you really able to identify that the need was great enough to really support it practice of itself?
Yeah, sure. So I definitely did do a market analysis, and I just tried to identify where was the gap in care. And I also even pretended to say that I was a patient looking for speech therapy services for adults. And I just Googled speech therapy in Stuart, Florida, swallowing therapy, voice therapy in Stuart, Florida, and looked to see what was out there. I even called on physicians' offices and just asked them, are you seeing a gap, or where do you refer? Are you having trouble getting your patients into speech therapy and to be assessed? So I felt like in doing that and seeing that there was a need in my community, it just really took off. It took off from there.
That's awesome. Is there any other sort of suggestions around doing a market analysis that you would recommend to any SLP looking to start something on the side or their own practice?
Yeah, I would say, like I said earlier, look into Google, look and see where are their possible competitors, where are they located, what do they specialize in, and really knowing what you love to treat, looking to see is there a need in my area. Some of the stroke support groups and then Parkinson support groups in my area were being held, with people masked and honoring social distancing. And so I went to those groups. I went to those support groups, and I asked people, I asked the caregivers and the patients, are you having, a hard time getting in for speech therapy? Do you think there's a need for that? And a lot of them told me that there was. Yeah, it's just for me, there were just lots of signs that, yes, yes, there is a need.
And you didn't have to come from a position where you were convincing people that this was a service that they needed. It was just open, but the gap was there and you saw it. Or was there, I don't know, maybe other ways that you were able to kind of branch out to convince people that this was a service that they also needed?
Well, so I spoke at our local Parkinson's support group. And like with Parkinson's, a lot of them are not aware, say, of their disabilities so much. And so, and providing education to them, again, speaking to their spouses or caregivers there. Their spouses, would look at me and say, oh, yes, they would shake their head behind them saying, yes, he needs speech therapy. I can't hear him. So, there didn't really have to, there didn't have to be too much buy-in with that population. And honestly, same goes with the stroke support group. Yeah, a lot of them too felt like, they needed another round of speech therapy. It had been maybe 6 months or a year or two, and they were ready to dive in and receive more therapy.
That's awesome. It was a lot of boots on the ground work, but clearly you saw success with it and you were able to reach out to a whole group of people. And it seems like a short amount of time before your clinic really started filling.
Yes. I mean, I would say so, right? Because now there's four of us. I had a graduate student, and then she became my CF, and then I hired her, continued on with her Cs. And then this last year, we've just gotten even busier. So I've hired another part-time SLP. So I know that the need is there, and there's even more people out there that are not served. So we're here for them.
That's great. So SpeechRx really feels like it's a center of excellence for dysphagia. So how did you build that level of specialization? I know we talked about it a little bit with the fees service you were offering, but what else helped to just build trust with referral sources and et cetera?
Right. So I guess getting back to say the head and neck cancer population, I took lots and lots of courses during those years, becoming manual therapy trained, lymphedema therapy, MLD trained. I took an ARC-J for trismus class or CE over a weekend. I marketed to radiation oncologists, to oncologists. I went to those specific physicians and met with their office managers and met with their medical assistants and told them what we could offer that maybe other places didn't offer. Let's say, like with the neurologist that we marketed to, one of my speech pathologists is a lingraphica certified specialist. And it was great working with AAC, with those with aphasia or primary progressive aphasia. And so I do recommend to people that are looking to start an adult practice, again, to just take an inventory on yourself, look to see what area of speech do you love and really hone in on your skills. Just dive in deep, do lots of reading, take the coursework and get those certifications and and those specialties under your belt, because I think a lot of physicians, they like that. They like to hear that you are fully trained. And then also we always provide with a Medicare rule, like that 10th visit note, those progress notes. We send the fee swallow studies with the images. Sometimes when I actually go out marketing, I'll bring a fee study and I'll show a before and an after speech and swallowing therapy. So, I think those are the things that physicians really like to see. And also, really, word of mouth. We've had a lot of our patients go back to their doctors and, quite honestly, just give us really good feedback. And so, those physicians, then when we've done marketing, they say, oh, so and so is doing so great. Thank you. And, I really do believe in word of mouth being such a great marketing tool.
Yeah, I definitely agree with that, that it kind of helps to just snowball everything. What
Sure.
sort of helped you like get your foot in the door with some of these people? Is it really networking, people that you had worked with previously, or is it cold calling? What sort of helped you start those?
Yeah. Honestly, it's a bit of all of that. I did all of it. The cold calling, I like I said earlier, I did go to the physician's offices that I knew from the hospital, but I also went to a lot of networking, like after hours events with like other home health providers too. Maybe that's not quite as much with the pediatric practices, but with the home health agencies around, you could market to them and say, okay, after your patients are finished with home health, you could, refer to us for outpatient therapy, doing things like that. I joined our local chamber of commerce and just got to talk about SpeechRx. So for the first, say, like 6 or 8 meetings that I went to, you're considered a newbie and they want to learn about your business. So I felt that, the chamber really helped. And I also reached out to PT practices in my area. I reached out to PTs that I knew and that I've gotten to know through the years. And so they've been a great referral source too. And when I think about it, even some OTs, I have some friends that are hand specialists that maybe work with stroke patients. And so then we refer back and forth to each other. So always reach out to your PT and OT colleagues because they're a great referral source for you too.
Mhm. Do you have any relationships too with maybe other speech therapists in the areas that are also doing maybe are a part of another niche, or maybe you guys can refer back and forth based off of that?
Yeah, well, not so much. There's not so much of that. There's a hospital-based outpatient center, and we do occasionally refer, but also I know speech pathologists in other hospitals, and so they sometimes refer. And then I do know, several pediatric SLPs in the area too. And that happens with us because we're listed, say, in a lot of insurance plans. We'll get calls from moms saying like, "Oh, I need my 3-year-old to come in," and we have to say, even though it says on our website that we're an adult private practice. I think because we're in a lot of insurance networks, we still get those calls. And then I have a list of pediatric practices that I refer to. And then I think then they the same. So then that's, that's reciprocal. And so that's worked out great. But all of this has taken time. Like I said, started in 2020, really 2021, like late 2021 was when I went full time with this. It does take time and perseverance and honestly, a bit of grit. I mean, it's not for the faint of heart. You've got to sometimes put that ego aside and just lean into yourself. But really, I just feel like our field is it's just so great. And we can just do so many wonderful things for people. And a lot of physicians' offices, they know what a PT does. I mean, most of them know what physical therapists do, but it's actually challenging and even fun for me sometimes to go in and market and bring lunch and then talk about voice therapy or cognitive communication therapy. Or another thing I haven't spoken about yet is chronic cough therapy. We, as several of our therapists, specialize in treating airway and chronic cough. And that's sort of an eye opener to some of them. So I just think us being able to get out there and talk about what we do more than just say treating stroke patients, which is so important. But I think initially that's what physicians think of for speech therapy for adults is, okay, I'll refer to you my stroke patient.
Yeah.
So
How do you feel like you've handled that, like in the first couple of years with juggling, seeing patients, trying to market yourself, build these relationships? How did you juggle it all? Did you kind of time block or try to block days off to do each thing?
I did do that. I did time block. And then what's worked for me right now is that I don't see patients and we are not open technically on Mondays. So I do have an office assistant and she comes in and she answers phones and checks voicemails and checks faxes and things like that. So I use that day for like an admin day for me or to do marketing, to do billing. I mean, I think that is needed as an owner. And then through time too, I have scaled back a little bit. I haven't been treating as much so that I can further market and do all of the admin work that needs to be done.
Yeah, that's a lot to start and to kind
Hmm.
of grow from there. And like you've said, there's so many hats that we wear when we're a business owner, and it sounds like you
For
were able to
sure.
grow. So at what point do you think, like when you first started, you were seeing patients, you were growing the practice. For someone who maybe is just starting or considering this, do you have almost like an idea or a timeline of like, listen, in the first year you're gonna be doing this, and maybe in the second year you can grow, or just general different goals you could look for?
Yeah, I would be happy to discuss what I did, but I have to admit, I think because I opened during COVID, it was just different. Everything was so different and that different in the fact that maybe like I was saying earlier, I had more of that downtime because there wasn't a whole lot going on. But I recommend people, if they're really thinking about it, to kind of start it on the side. If you do need a full-time position, start it on the side, maybe one day or even Saturdays. I did consider that at one point. I did consider offering Saturdays. And then it just worked out that I didn't have to do that. But I think that's definitely an option for people. Or if you're working part-time somewhere, just start that private practice part-time and maybe start virtual therapy and start going into the homes because owning a practice where you have a clinic or an office is just a whole other beast, a whole other thing to tackle with, rent and all of the overhead that a clinic comes with. So for some doing home health, it might be their calling. I just knew that I wanted to be in an office and have a clinic. And I have to admit too, I think I knew there were a lot of home health agencies around. And that also brings me to, and initially too, I thought I was going to do mobile feeds. I tried a little bit to, get into local skilled nursing facilities and ALFs, and I met with them. But again, it was COVID, 2020 and then 2021, and it just was not happening. They were not letting new vendors into their facilities. They were very strict about that. And so I just quickly found that, you know what, mobile fees is not going to work for me. But in retrospect, I think being in a clinic for me, just for what I like, providing fee swallow studies in an office just works out best for me and for the other SLPs that work with me.
Awesome. At what point did you decide to take on the beast of insurance?
Yeah. Well, really right away. I mean, we became Medicare providers right away. And that really wasn't too difficult. I think I got in within about a month. And then we just slowly started ticking away. Well, I say slowly, but we did try all the major insurance companies. I will admit I have become out of network with two of the insurance companies that I was in network with because of the low reimbursement. And their reimbursements were just not feasible to sustain an office. Maybe if I was a solo practitioner, if I was going into homes, it would be sustainable. But for a clinic, I could not sustain being paid a flat rate for an eval or for therapy or even to provide fees. They wouldn't budge. So I've become out of network with two of those major insurances. And you know what? It works for us. We have people that say, that's okay. I have out of network benefits. So I'll still come to you. I'll have a higher copay, but we'll still come. But then we do have others that say to us, you know what? I need to find somebody in network. I want to use my insurance. I want to find someone in network. And so we just let the physician's office know that we're not in network and they're choosing to find someone else. So that's been a very good move for us. I'm actually considering maybe going out of network with another insurance company just because I'm noticing in 2026 their rates are lower. But we've also restructured and gone back to two of our insurance companies and we've renegotiated and now we have higher rates. It's a bit of a balancing act.
Mm. For sure. I think it's something a lot of people are kind of afraid to tackle. So is
Right.
there maybe something or a piece of advice that you have for them where, is it just kind of do its best for you? Or is there something else maybe that you would suggest to consider?
Well, and I think looking at those rates, getting their fee schedule, reaching out to these insurance companies, seeing what their fee schedule is, or if you have a friend locally or a friend in your state, because every state it's different, and seeing what those fee schedules are and seeing if that works for your business. It might or it might not. Again, it depends on the size of your business and what you're willing to do. We did have someone help us with credentialing, and that was helpful too. But some of it was trial and error. The very first insurance company that we signed up with was the one that I told you was just going to pay us the flat rate. And we thought, you know what? Well, we're just going to try it for a while. And we did. And then we found out this is not working for SpeechRx. It's not working for the business. So we became out of network with them and it's worked.
And thank you for sharing that. And that is a lot of really good info for people to consider as they move their private practices along. So one
Right.
thing that really also stands out about SpeechRx is that it feels like more than a clinic, it's more like a community. So was that intentional from the start?
I would say so. So when I worked at the hospital, I ran a stroke support group for 10 years. And I expanded that group to different hospitals. And I love helping others and being an advocate for those that need that support. And I love advocacy work. And so, yeah, so we started Dysphagia Digest of Florida. So we provide support groups for those with dysphagia. Most of them in our group do have head and neck cancer, really, because their dysphagia is just long term, really with them for a lifetime. But then we also started a communication wellness group for those with aphasia and with communication disorders so that they can meet up together and socialize and a fun. environment. And I think our physician offices and groups, they love that we provide that level of support in our area because there isn't much of that. There is a local adult daycare center, and they do provide some support groups and groups for caregivers, but it's more for people with dementia. So our communication group and our dysphagia support group, really help us to stand out and make us a more unique.
That's so awesome. Have you seen any impact on particular patients with this, or how has it impacted different just patient outcomes?
Oh, yeah, sure. I mean, they tell us that they look forward to coming to our group, every month, and their spouses enjoy coming and or their caregivers. And it's really made such a huge difference. And we have some in our Dysphagia Digest group that have been coming for 5 years and they look forward to it every month. So it really, and it's helped also retain them. And sometimes we'll take a break from therapy, give them 4 to 6 months, a little break, and then they come back. And so, it is a good way to keep your referrals and then word of mouth. I think referrals coming in as well. It's just something that SpeechRx and the therapists here, they really feel strongly about is just helping the community, not just, coming in and providing therapy, but really helping their spouses and their caregivers on a day-to-day basis and in their real world.
Well, yeah, it's a resource to the community. It also kind of creates more of a backbone for the business as well, like you said, with referrals and for growth. And it it makes your practice stand apart from just an average practice, for sure. So for clinicians listening, do you have any advice for how they can start thinking about becoming more of a resource in their community and not just a provider?
I would recommend going to support groups. I think that is a great way to help promote yourself and potentially market yourself. Volunteer to be a speaker at one of those groups. And maybe even just as simple as, what is speech therapy, say, for kids, more than just artic therapy, or what is speech pathology services? What do they include for adults? Whatever your niche is, I think being that resource person and speaking in groups or like at a chamber of commerce event, that really helps you to stand out and look more as a specialist or an expert in your field.
Mhm. That's great. That's really good advice. So, most people also say adult private practice is too hard, but you guys are thriving. So, how are you growing a sustainable Medicare focused adult practice with a very tough healthcare economy?
Medicare for adults has been great. They pay well, they pay timely. I would say a little over 50% of our practice is Medicare. We do not have a huge private pay clientele. Maybe that's something that we will branch out into the future. But in my area, and I think you have to look at your geographical area, we do have a lot of retirees and a lot of 65 plus adults in our area. So a lot of them, and they want to use their insurance. And then if you're a Medicare provider, you have to take their Medicare insurance. But I think I'm finding again in this area, people they want to use their insurance. Now there are an insurance or two that we are not in network with at all. We don't have the out of network benefits with them as well. So sometimes we can take private pay from them, if they're willing to do that. But I think providing a niche therapy. I know I feel like we keep saying it over and over, but I feel like that is what will help you to stand out and to really market what your niche is. Or then if you come to a point where you have a few providers, market that.
So, thank you for those tips. So, for anybody maybe who's listening who's really feel like they're called to start something of their own. They're not sure where to begin. What would you say to them? You gave a lot of really helpful tips, but maybe what's like one step that they could do this month?
I would say identify in your area, where is that gap? I believe you don't need zero competition in your area. You need unmet demand. You need to try to fulfill that. We know a lot of it has to do with supply and demand, and where is that demand in your area? I mean, a tip that I would give to any, say, pediatric SLP in my area is we do not have myofunctional therapists. Because we have people that sometimes call, and so I've told people, you know what, become a myofunctional therapist because there's a big need for that. Also, in our area that I'd like to sort of highlight is we have a speech pathologist that specializes in working with people that are hearing impaired with new or newer cochlear implants. That's another niche market that we need to, reach out to audiologists and ENTs in our area. Is that we have an SLP that really specializes in working with adults with cochlear implants, but that might be a good suggestion for a pediatric SLP because that too I think is definitely more niche. And if you can stand out as a specialist in your area, that could bring you lots of clients and lots of referrals.
That's awesome. I love that, where it might feel scary to feel like, oh, I'm only going to see, I don't know, niche down so much, or maybe you feel like you're excluding other people from what your practice is about. But it sounds like that's something that could really make your practice stand out from the crowd. So, if there's
Right.
also one takeaway that you want clinicians to leave with about building a practice that truly serves their community, what would it be?
I would say search like a patient. Like I was saying earlier, pretend like you're a patient needing a service and just dive deep and look on the web and just see who's in my area. Where would I go? Where would I go if I needed it? Where would I go right now if my mom or dad needed services? Or where would I go if my child needed services? Where would I want them? Where would I want them to go? Where is the specialist in that area? And so if you look and you see it's not there, it's not in your area, then you can build off of that.
So, that's great advice. So, is there any resources that you would like to share? How can people connect with you? Or if they have any follow up questions, how can they get those answered?
Sure. So anyone can email me at info@speechrx.org. And you could find us online at speechrx.org. We are on Instagram and Facebook and LinkedIn. Instagram is SpeechRx Therapy. So we'd love to hear from you all. And I love mentoring new or upcoming SLPs. And when I started my practice, I had three other friends that were also starting practices, and we were all in different states. And it was just great to have the group of mentors to go to and ask questions, with all the time. So, if anyone needs help or has questions, feel free to reach out because it's doable. It is absolutely doable if it's something your heart's calling you to do.
Thank you so much. You gave so many helpful tips, resources, different steps for people to take. I absolutely loved this interview. So, thank you so much for coming.
Oh, thank you. I appreciate it.